Okay. Great. Hello, you all. We've got our webinar happening tonight, Advocacy in Action. We are going to wait for folks to kind of pop in, and I see people coming in. For those of you who don't know me, my name is Dinah Winchester, and I work for Alliance to Cure. As you come in, I would love to just see how you're doing. Where are you tuning in from? And what's the weather like? You can add it to in your chat. We can see where everyone's tuning in from. I'm in Sacramento, California right now, so it is warm, even though it is October. But it's not hot, so that's good. It was really, really hot. So, Southern California, Philadelphia, Wisconsin, Washington, Detroit, 53 degrees out right now. That feels so cold to me. Louisville, nice. Good stuff. Well, we'll start in just a minute. Hi, David. Oh my gosh, 76 and breezy sounds delightful. Yep, DC. Good stuff. Well, I think we have a critical mass, and that sounds great. Maybe we'll just wait one more minute here. Good. Okay. All right. So welcome everybody to our Advocacy in Action webinar. Again, my name is Dinah Winchester, and I am the Director of Strategic Partnerships at the Alliance to Cure Cavernous Malformation. I got involved with the organization 5 years ago, when my now 6-year-old daughter had a hemorrhage and a brain surgery, and so I found us, and I'm really happy about that. And we are going to be talking tonight about kind of just advocating for ourselves as CCM patients. And so I'm very pleased and honored to have a panel of participants, or of speakers tonight, who are going to kind of give you their take on a few topics that are interesting. We are going to, at the end of so a few housekeeping notes before I forget. As you have questions that come up, please put them in the Q&A, and we'll try to get to them at the end of the webinar. You can also carry on in the chat, but we won't be able to necessarily see everything in the chat. And Darla has told me weekly support group is happening right after this. So tune in for that. And I think we can go ahead and get started. So first, let me briefly introduce our panelists. Today we have Chris Coates, and she gave a wave there. And she is going to speak first, sort of about advocating for yourself in everyday situations, disability rights. She has a really great presentation that she's going to share with you. After that, we're going to hear from Dr. Sara Sukalich, and she is going to kind of give us some tips on navigating the medical world. Now, she is not a CCM doctor, but she is a doctor, and so it'll just be great to hear her perspective. And then finally, we have Christina Campos, who will speak to us at the end about what she has been able to do in New Mexico to kind of advocate to do some legislative advocacy that has really resulted in some great benefits for our community in New Mexico. So I'll turn the floor over to Chris Coates after I'm just going to read you a little bit more about Chris. So Chris Coates is passionate about rare disease advocacy. Before her CCM diagnosis, she enjoyed working as a senior credit account manager for a large Caterpillar dealer. She has 2 children and a grandson, a dog, and 2 cats. She is married to her best friend and enjoys spending time with her family. She was diagnosed with a sporadic cavernous malformation and associated DVA in her cerebellum, fourth ventricle adjacent, in 2017. Her only symptom was daily migraine headaches. In 2020, the lesion appeared to be on the verge of a bleed. In an abundance of caution, her neurosurgeon suggested that the lesion be removed due to its precarious location. She had the surgery in 2021, delayed 3 times due to the COVID-19 pandemic. The surgery led to a further complication of hypertrophic olivary degeneration, HOD, thank you, an even more rare degenerative brainstem disease. She created a patient organization for HOD in 2021 and is the president and chairperson of the organization. Today, she is disabled and spends her time volunteering for HODA. And she is going to tell us all about advocating for yourself. So I will turn the screen over to you, Chris, and take it away.
Thank you so much, Dinah, and thank you to everybody who has taken the time out to attend today. This is such an important topic. I know for me, it's always been difficult to advocate for myself. I'm scared of my own shadow, basically. I'm not anymore, but I was. But I'll tell you how I learned to do that. Before I begin, I do want to ask for grace on a few things. I am battling a cold. I have been battling a cold for a while. And also I have anomic aphasia. So if I take very long pauses, please do not be, here it comes. Don't be awkward about that. It's okay. But if you notice, what I just did for myself is advocate. So that's how easy it can be. So I'm going to go ahead and move some things around and share my screen. And we shall begin. Forgive me, it's been a very long time since I've done anything like this. Okay, can you see my screen? Very good. So I've been asked to speak about advocating for yourself. Who am I and why should you listen to me? My name is Christina Coates or Chris Coates. I answer to either one, doesn't matter. Excuse me, as previously mentioned, I am a sporadic CCM patient. I did have a craniotomy in 2021, which led to some very interesting comorbidities. I need to take a drink. I'm so sorry. I worked in private industry until October 2022. I came back to work after my craniotomy, and it was interesting. I did the best I could for as long as I could, and then eventually had to go out on disability. So I am not, according to the US federal government, they don't think I'm disabled enough, but my work thinks I'm disabled enough to not be there anymore. Oh, forgive me. As mentioned, I am the president and founding member of HODA, which is the Hypertrophic Olivary Degeneration Association. I have a close connection with the Alliance because many, well, not many, but many of our patients come from CCMs and brain bleeds, usually in the brainstem area or cerebellum. I am so sorry for you.
No problem.
I'm the former vice chairperson of the Arizona chapter of the Alliance. As you can see in my pictures up here, we did have some walks. I hope to be able to reboot those again. It's been, I don't think we did one this year, maybe next year. I have 7 rare diseases. Please do not ask me to name them all. I can't remember what they are. This is ridiculous. And a few other not so rare chronic illnesses. I was unable to admit that I had a disability for most of my working career. I worked in accounting and finance. I am a rare disease advocate, and I'm a pretty cool person with a huge heart for this community. So um, I am so sorry. I should have brought a cough drop.
That's okay.
Okay,
You
here
got
we
it.
go. The most important takeaways that I can give you today is number one, understand your own needs and don't be ashamed of them. Find confidence to ask for what you need. That's why I have my Beyonce picture here. She helped me find a lot of confidence. And listen to your body and be honest with yourself and what you need. The hardest part in all of this is acceptance and being honest with yourself. I'll share with you a little later my story and how I failed at this. I failed at it impressively throughout my timeline in the public sector. But I learned how to do it well. What is the Americans with Disabilities Act? First of all, if anyone's tuning in from another country, I apologize. I live in the United States, so I don't really know other policy. Excuse me. But according to the ADA, the Americans with Disability Act, or ADA, is a federal civil rights law that prohibits discrimination against people with disabilities in everyday activities. It was not signed into law until July 26th, 1990. I know for some people that seems like a very long time ago. That was when I was in high school, so I was alive when this happened. They did do an amendment act in September of 2008 that was meant to expand the protections. I'm so sorry. Provisions under the ADA apply to all employers with 15 or more employees. So if you work for a very, very, very small business, it may not apply to you, of course. I do have the link here in my slides, ada.gov, that can give you more information about this. Children are covered under the ADA, and reasonable requests for accommodation cannot be denied. So, I mean, if you're asking for the world, of course, they can't give that to you. But if you're simply asking for something like telecommute days on migraine days or things like that, then they really would have a hard time denying that kind of accommodation. Why am I covered by the ADA? I don't feel like I'm disabled. Well, I didn't feel like I was disabled either. But cerebral cavernous malformation is a spectrum disease, and some cases are much more disabling than others. If I can get through it, I'm going to tell you a little bit about my story. I had my first migraine at the age of 18, and then I would have them maybe once a year until I was about 42, 43. And then I was having them every single day. Because I didn't want to appear weak, I powered through migraines every single day at work. I went into the office. This was before COVID. So we didn't have the luxury of telecommuting at that time. I would go into the office, I would suffer. I had to talk to clients all day long and do math and spreadsheets, and it was really a drag. And looking back, I really wish I would have advocated for myself and took advantage of things like ADA and FMLA, and instead of looking at myself as weak, seeing how strong I actually was for living with this, keeping up a more than full-time job and running my household. So I definitely learned how to advocate for myself at work. And this happened not through my disability, but because I was taking on a new gigantic role at work, and my employer didn't feel like they needed to pay me any extra money to do that. And I spent months advocating for why I deserved to be paid for the work that I was doing. And through that, fun story, I would listen to the Beyonce Lemonade album on the way to work every single day. Now, I'm sure that does not work for everybody, but it worked for me, and it gave me the empowerment to know my worth and to know that I am a productive, valuable member of the team, and I'm okay to ask for what I need. You're absolutely okay to ask for anything you need. Um, so as I stated, most of the time I failed advocating for myself because I was just too afraid to rock the boat or look like the person that always needs something, or the person that was always out sick, even though I had every single right to be. Um, there was a year when I didn't use one sick day. We used to get, I think, 12 sick days a year. I didn't use one. And I went into my annual review and I told my boss, hey, I didn't even use one sick day. Isn't that great? And he was like, no, that's not great. There's something wrong with that. So well, that was one of the beginnings of me learning that what I was doing was very toxic and not normal. I was having more loyalty to my employer than to myself. And I don't want that for anybody. It's a miserable place to be. So, what qualifies for a reasonable accommodation? Migraine headaches, seizures, depression, anxiety, brain fog, or difficulty thinking. We see a lot of that with long COVID. We share a lot of those symptoms together. Cognitive impairment, CCM, and any symptom that causes life impairment. So it always comes back to acceptance. Unless you accept that these things are disabling to you, or you're needing an accommodation, then nothing's going to change. I was just scared, as I said, to ask for accommodation. So how do you do it? First, you need to admit that you need a change in conditions to thrive. So if something like telecommuting or wearing sunglasses at your desk or having to pre-board a flight is something that would help you, then ask for it because those things are available to you. The worst that can happen is that you can be denied and life goes on. No big deal. Nobody dies. You just keep going. The best way to get your accommodations is to show up with a plan. Um, this is what I'm experiencing. And of course, you can share as much or as little as you want with whomever you're speaking with. These are the accommodations that could help me. And what is the process of getting those accommodations put in place? I'm happy to get doctor's notes, or I'm happy to do whatever I need to do to get those things. Um, Also, I skipped over this, but admit to the person that you're speaking to, whether it be your manager, your HR department, school administration. I was recently at Disneyland, so theme park came up, airline, etc., that you have a medical condition that you need an accommodation for. And don't be ashamed to ask for those things. Most companies will have a policy handbook that you can refer to that maybe give you an outline of what the steps are. But I, at work, started with my manager, and then he referred me to HR, and it was a very good, productive conversation at that point. And then I basically mostly worked with HR, and they told my manager what was going to be. Um, Most HR departments, we hope, would be open to listening and understanding. Mine was shockingly very open and understanding. And honestly, when I went on disability, they were like, what's taking you so long? We knew that you needed to go a while ago. But, they can't say that. So When is it appropriate to advocate for yourself? It's appropriate everywhere. I did it here before I started speaking. I let you know. Sometimes I have troubles with remembering words and I have a cold, and obviously I've been coughing the entire time. So it's okay. This includes doctor's offices, which Sara will, I'm sure, speak to shortly. Um, I've had doctors dismiss me. My neurosurgeon, when I told him after my surgery that I was diagnosed with HOD by the Mayo Clinic, he said, "Oh, that's interesting. Guess who's not my neurosurgeon anymore?" Because I'm not going to put up with that. That's not the appropriate response. And so I'm advocating for myself in that position, even though in the power structure, he is a PhD or whatever. But my thought is always, they may have a PhD, but I'm the CEO of me. And if you can keep that in your head, that helps to build some confidence as well. Again, find your inner Beyonce or whoever, maybe Taylor Swift, I don't know, whoever inspires you that has a lot of confidence, keep them inside of you and declare what you need. Don't, I mean, I ask, of course, politely, but I often will say, "This is what I need. How are we going to do this?" I don't always give people an option to say no, and that's okay. I wasn't always that way. I was always kind of a pushover, but I'm not anymore. If you know what you need, make the request confidently. You will likely not be turned down, and that's the truth. If you're working, you may qualify for additional job protections under FMLA, but some requirements must be met. So I would definitely either speak with your HR department or you can look it up on the internet. Lots of information is out there. And most importantly, stop caring what other people think. It doesn't matter. It's none of their business. It's your business. And CCM can definitely be life-changing, and having some accommodations might help make things better for you. So don't be afraid to ask. Finally, if you have comments or questions, first of all, I'm the world's biggest hype man, so you've totally got this. If you need reassurance, you can always reach out to me. Um, I'm around. This is my email address. You can connect with me on social media. I'm around. Please feel free. I absolutely love talking to people. Strangely, I didn't used to, but I do now. So find your confidence and you can do this. I promise you that. And that's all I've got. Thank you.
Thank you so much, Christina. That was super informative, and I think you just modeled exactly what you said. So we really, really appreciate that, and we'll have time for questions for your presentation at the end. Um, we'll move on to Dr. Sara Sukalich now. I'm going to read you a little bit about her. And okay, here we have it. Dr. Sara Sukalich is an OBGYN with over 20 years of experience in medical education administration. She has overseen the education of medical students, medical residents and fellows, and advanced practice provider students. She graduated from Harvard College and obtained an MD and Master of Medical Education from the University of Cincinnati. She is also a certified health and well-being coach. Dr. Sukalich is serving on the Alliance to Cure board for the second time, having served as board chair from 2010 to 2013. She was diagnosed with multiple cavernous malformation in 1994. Subsequently, family members in 3 generations have been diagnosed with the CCM1 mutation. She lives in Columbus, Ohio with her husband. And also, real quick before I start, I did get a very good message on the chat here that is just to say, like, this is not legal advice what we're giving you guys. It's sort of your personal experience, and please, especially for specific question, there's lots of ways to get more information, like in support group and things like that. But yes, so Sarah's going to give us just an overview of how we can advocate for ourselves in a medical setting. So I'll pass it over to you.
Yeah, great. It's wonderful to be here, and I appreciate Christine things off for me because I do want to reinforce some of the things that she had to say. So um, there is a feeling a lot of times. I am a doctor, but I am also a patient. I've been on both sides of it. I've been in places as a caregiver. There's this feeling sometimes that doctors are up here and we little patients are down here. And the reality is we're all human beings. And I think that we need to walk into doctors' offices with the expectation that we're going to be respected, we have the right to be heard, that we have the right to ask questions, and we have the right to raise concerns about our care. And it's a red flag to me if your doctor doesn't respect you. So just keep that in mind. And yes, we have to advocate for ourselves. And as Chris said, I think she said, we're the CEO of me. I would say you're the expert in your own life. There's no doctor that's living in your body that's having the experiences you're having. So your experience is your own, and it's really important. So your doctor should actually be your partner. They shouldn't be, this amazing person that's telling you what to do. They're a partner in how you take care of yourself. So I just have some tips for how to advocate for yourself, how to maybe make the visits most worthwhile. I think we all know that doctors are really busy. We don't all want to be that busy. It has a lot to do with finances and the economy and expectations and insurance requirements. There's so much that makes it hard as a physician to spend as much time with patients as we want. So to respect that there's going to be challenges there, a really great thing to start a visit is be on time, complete all your paperwork, be ready. That way, that's not a barrier for the doctor. Be prepared. So think about what you want to talk about, have all your records together if it's a new doctor to you or if something's happened since the last time you saw that doctor. A great idea is to think about what you want to cover in a visit and then practice. So most doctors are going to start, or I hope they do, by asking a question. Why are you here today? So you can actually practice yourself or your caregiver what you're going to say, because that's going to be the time when you're going to be able to say something to your doctor. So, prioritize what you're going to say, what your concerns are. Keep in mind that in a 10-minute visit, 20-minute visit, we can't get to every problem that someone might have. So prioritizing them is really, really important. I recommend taking notes. I take notes myself. I don't always remember the things that I'm being told. So I think that's really important. And then during the visit, advocate for yourself. If you don't understand something, say it. If you feel like you've said something and you're being misunderstood, say, can I try again to tell you this? Stand up for yourself. Like Chris said, we have to advocate for ourselves. It's especially important for you to understand follow-up plan. So that's one time you really want to know, this is what the doctor is saying we're going to do, or I need to do, or they're going to do. And you really need to be clear on what that is. So that's a great time. If a doctor doesn't say to you, can you tell me what I just said so that we're sure we're on the same page? That's a good time for you to ask. This is what I heard you say. Is that the thing that we're going to be doing? Everybody, when they leave a doctor's office, has to have their after visit documentation handed to them. Look that over. Make sure that what you heard is what's on that document. Great to take a supporter with you. A lot of people are going to be there with a caregiver or a supporter, but if you're someone that sometimes goes to appointments by yourself, take someone with you. You have the right to have someone be in the room. You also have the right to have a second opinion. And I think this is sometimes when it gets really tricky for people. We sometimes feel like we're going to upset the doctor. The doctor might think we're criticizing them when we ask for a second opinion. It is your absolute right as a patient, as a person, to have a second opinion. It's a huge red flag to me if a doctor says, well, you don't need a second opinion, of course, I know what the plan is. There's no reason to not have a second opinion. It can be challenging for some of us depending where we live and what resources we have to get to second opinions. But through the Alliance, we do have information for you on how to get those second opinions, even if you can't physically go for a second opinion. And then in the end, again, you're the expert on yourself. If you're not getting what you want from a relationship with a physician, it's okay to move to a different provider. Sometimes that feels like, oh, they're going to be mad at me. It's your life, and they don't owe you anything. You need to get the best care that you can. And so that's okay. So I wanted to just make sure that everybody knew where to find some really helpful information on the web. So I'm going to share my screen. I'm betting that a lot of you are familiar with the Alliance's website. I think it's got so much information that sometimes some really important things that would be helpful could get lost. So I'm just going to point a few things out here. And also, part of that being prepared and advocating for yourself is getting information even before you go to see a doctor. But it's a little bit of buyer beware. So almost all of us are now Googling things before we go see a doctor. We expect that as doctors. Not everybody is comfortable hearing those words, oh, I looked on Google and this. So we know you're going to do it, but just know that not every doctor feels comfortable with that. The way you can do the Googling the best is to make sure that you're looking at a reputable source. If you Google cavernous malformation on Google, you're going to get, a lot of us are getting this AI overview. You can't accept what the AI overview tells you as truth, because all the AI is doing is picking information that's already on the web, and it could pick a source that's not great. So if you're looking at these AI overviews, if you click on these little, whatever these little symbols are, it'll tell you where that came from. So what you want to think about doing for where to find things on Google, look for very reputable organizations like the Mayo Clinic, Cleveland Clinic, national organizations, nonprofits, advocacy groups like the Alliance, the CBC, Medscape is another a good source. So just be careful with what you read and believe when you ask Dr. Google. But we know as physicians that you guys are looking, because we do too. So a couple things to point out on the website. Most of the information I'd recommend when you're preparing for a physician visit or advanced practice provider visit, you can actually find under this newly diagnosed section. So the things I'd highlight, one is, if I can get this to move over here. Wow. Failing. Okay. Well, one is here on this newly diagnosed section, there's the questions to ask your doctor. And that's really helpful. It's information that we've put together for you that can, you could just take it to your visit, and you're preparing, or when you're preparing ahead of time, it'll help you know some things to ask. The other thing that's on here that's really helpful is the clinical care guidelines. And those are over, I don't know why I'm struggling so much with this website right now. On the right side there, it says CCM care guidelines. So when you click that page, you're going to have a really nice landing place that actually professionals can get to as well. So this CCM care guidelines, these are due for a revision that's going to come up really soon, which is exciting. But in the meantime, please feel free, and that you should, print it out and take it to the doctor. And that might be your neurosurgeon or your neurologist, but that could be your primary care doctor, your pediatrician, anybody that you think might benefit from knowing about your rare disease. So I never think that that's a bad thing. If patients are prepared and they come with that type of information, I'm going to take a look at it. You also could send a link to your doctor to the care guidelines. I sent that guidelines to my neurosurgeon. I sent the link to him. He was, very happy to have that at his disposal. So that's another good thing. And then finally, I wanted to share the Centers of Excellence. Dinah, I should have let you drive because
No, it's I don't know what's happening with
I
the
know
website
it's been
right
like
now.
really twitchy.
I know. Well, you guys, if you Google now, if you do Google Alliance to Cure Centers of Excellence, that will come up, I hope.
Let's try it.
Yeah, let's try it. And that's always just a great, there we
All
go.
right, look at that. Okay. So if you go to the Centers of Excellence, which again, you can get from that newly diagnosed, or the professionals can get to it. These are organizations that have been thoroughly vetted by the Alliance, and they are meeting the standards that are in those clinical care guidelines. They have the right kind of doctors, the right kind of support on their team. They all have to have websites where you can find them. So it should give you great confidence if you go to a Center of Excellence that they already have the stamp of approval from the Alliance. Each of these has information about the organization. And then you'll be able to find information like this. This is Dr. Smith. He does, he's a pediatric neurosurgeon, and he does case reviews. A lot of us have gone through that system. And then usually further down, you'll be able to find the website that organization, so Boston Children's, has about cavernous malformations. And each of those Centers of Excellence is going to have that type of information. So I would just say use the Alliance website. A lot of effort has been put into it for the last 22 years. So it's there for you to really help you advocate for yourself. So I think that's all I have, but please, you are the expert in you, and you are the one that cares the most about being well taken care of. So definitely need to advocate.
Thank you, Sarah. Super clear. I was writing notes down to myself about what I need to do in general when I see doctors. So thank you. Okay, we are, and again, I've got questions coming here, so that's great. And feel free to drop questions in, and we'll talk about that at the end. So next speaker is Christina Campos. And I'll read a little bit about, I'll introduce you, Christina, to our group. Many of you guys already know familiar faces here, but here we have Christina Campos. She has served as the administrator of Guadalupe County Hospital, a 10-bed PPS hospital in rural Santa Rosa, New Mexico for over 19 years. That may even be, yeah, you'll update. Okay. I got this from our website because you are a board member. Under her leadership, her hospital was recognized as a top 20 community hospital by the National Rural Health Association in 2019, 2020, and 2021. She currently serves on the boards of the New Mexico Hospital Association, the New Mexico Hospital Services Corporation, the New Mexico Hospital Equipment Loan Council, the New Mexico Rural Hospital Network, and the New Mexico Mutual Workers' Compensation Casualty Company. She previously served as a former American Hospital Association board trustee, a former member of the HHS National Advisory Committee for Rural Health and Human Services, and chairman of the New Mexico COVID Economic Relief Council. She's the president of her community's Local Economic Development Corporation and Main Street Corporation. She's married to Joseph Campos, and together they have 3 adult children and 2 grandchildren. Joe and 2 of their daughters are affected by the common Hispanic mutation. Christina and her husband also own and operate a family restaurant, Joseph's Bar and Grill in Santa Rosa. So Christina's here tonight we wanted to hear about your experience. Well, first of all, I think as a hospital administrator, you can also weigh in on, any questions that come up about sort of navigating the medical world with CCM, if we have questions at the end there, but also, uniquely, you've been in this position where you've secured a lot of funding for CCM patients through advocacy. And correct me if I'm wrong, but I think it was a total of $720,000 that you and others in New Mexico were able to secure. So we would just love to hear that story. I know you've told it several times, but I think it is I don't think everyone here has heard that story, and I think it's very inspiring. So I'll just kind of turn the floor over to you, and you can tell us about your story and how all of this began.
Right. Okay. Well, thank you. And, there's a few updates. I am retired. So I served as CEO of my tiny hospital for 20 years, and I retired in June and still kind of getting used to this new life. I'm more involved in the family restaurant. As you mentioned, my husband has CCM. And we found out back in 2013 when our middle daughter was on her honeymoon in Bali and she had a massive seizure. Her new husband of 1 week rushed her back to New Mexico, and I convinced her to come to my hospital so that she didn't have to run through an urban ER and wait hours and hours. And we did some of the diagnostics here, and we were able to use telemedicine and diagnose her. And then we're able to get her to the UNM Center of Excellence in Albuquerque, and she had brain surgery because it was a very large angioma in her temporal lobe and in a pretty sensitive area that they were afraid that if it bled more or again could cause some severe deficits. So we knew then soon after that, we decided to have the rest of the family tested. And that's when we found out that my husband had it and my older daughter. And then by then my older daughter had 2 children, and we tested her daughter, who was about 5 or 6, and then the newborn baby. And her daughter was positive also, and the baby negative. So my son and my grandson and I are negative. My husband had been a legislator for 8 years here in New Mexico, and he had been a mayor in our small community for 16 years. Very active, very busy in the business community as well. But in 2018, he had his first bleed. And at that time, when they did the imaging, we found out that he had over 500 angiomas in his brain. We knew he had the gene, but we're just absolutely shocked when we saw the images. They just quit counting at 500. So, after that, you just don't need to know anymore. It was the angioma that he had at that time that was bleeding was quite large, but it was in the thalamus and was considered inoperable. The risk was too high. It did recede, and he did really well for about 1 year and 3 months. And then the following year, it just came back with a vengeance and much larger. He was losing a lot of his cognitive abilities. He was losing strength and dexterity on his right side. Losing his vision, has very severe aphasia. And it was just happening so rapidly. So at that point, UNM, the university, was still considering it inoperable, but we were able to get connected with the Barrow in Phoenix. And Dr. Lawton looked at his images and said there was one procedure that he had been trained in that he could do. It was called a transcallosal transchoroidal approach, where they basically went through the 2 hemispheres of the brain to get to it and remove it. And it was the surgery itself was successful, but his deficits are still fairly severe. He still suffers from aphasia, but is able to speak and now full sentences, but they can come out fluidly, and other times they just don't come out. Memory is kind of spotty. For a while, he couldn't read a clock. Now he can. Has not worked again. So he hasn't worked in over 5 years. So I've taken on the restaurant more than than I had in the past. But during that time when he was at the Barrow and we were going through this, we know that we had a lot of people reaching out to us from the legislature. He had been retired from the legislature for many years, but had people reaching out and saying, how can we help? And at that time when you're going through that type of a family crisis, they can't. There's nothing they can help. But you file it away and say, eventually you may be able to help. And it was a couple of years later, I started getting more involved in the Alliance. My daughters are the type like, hey, Mom, let's make dinner. And I end up making dinner. Or let's paint this room. And I end up painting the room. And that time their idea was like, let's get involved. Let's start advocating, which meant I was going to advocate, which is fine. I enjoy doing those things. But around that time with my involvement in the Alliance, Connie Lee, Dr. Lee reached out to me. She was coming out to New Mexico for a conference and said she wanted to talk about trying to get some funding from the legislature. And for many, many years, she had worked with people from here in New Mexico who had been advocating, but hadn't been able to overcome some of the barriers to working with the legislators. And she wondered if, because of my connections through my husband, and also having been a rural hospital administrator for so many years, I had to do some advocacy for my hospital and for hospital funding and regulation and such. So she had some names that they had worked with in the past for memorial to study CCM in New Mexico. And I don't know if you're all aware, but the Hispanic mutation CCM1 is fairly prevalent here in New Mexico, with estimates of up to 30,000 people being affected by it, but most people not even realizing it because they haven't been tested. So she asked if I could, see if we could make outreach to our legislators, come up with a plan. So our first plan was to get onto a legislative committee, an interim committee. New Mexico legislature is part-time. It only meets once, 1 month or 2 months out of the year, depending on odd and even years. So the first step was get on a panel or an interim committee hearing and be able to talk about the issue. The doctors from UNM went with me, the new doctors. There's as Sara will tell you, there's a lot of turnover in the system right now. And so the new chief of neurology went with me and some other folks. And we were able, with the help of one of the legislators who had helped in the past, we were able to get on that panel and give a presentation. One thing that was very important about the presentation is that it has to be twofold. You want a doctor who is credentialed and respected and is going to be trusted by the panel. But sometimes just that intellectual educational information isn't what tips you over and gets results. It's the personal stories. A lot of times when we go to different hearings, it's the personal experience that catches their heart and their attention. So I was able to relate the story of my husband, and many of them knew him. They knew him before as an active legislator, and then I could tell them where he was now and what we had gone through. So it's a very dramatic visual, in their imaginations. We also took with us to that meeting a genealogical book that was written here in New Mexico about all the different families in New Mexico that are affected by CCM. And one of the most impactful statements was, turn to page such and such, and you will see the family tree of all the families in New Mexico that are affected by this, and all the last names in New Mexico that are affected by this. And you have maybe 15 legislators up there, and a lot of their names, a lot of their family names are on there, or their mother's family names, or a cousin's family name. So that personalization of the disease is incredibly important to the legislators. So with that, there's so many rules and regulations on funding and budgeting, and we had missed some deadlines on budget. So you have to know, when is a budget being developed? And if you can't go in through the front door, can you go in through the window? So we couldn't get direct allocations through the budget, but each of the legislators were getting allocated funds for their pet projects, what used to be called pork. Or they call it at the federal level their congressionally directed spending. But these legislators are allocated so much. And we were able to reach out to several legislators and say, hey, I hear that you're getting so much money. Would you consider dedicating your money to the University of New Mexico to do outreach and genetic testing and education? So we need to educate our rural doctors. And we really wanted to reach out to primary care providers throughout the state. They are your gateway to healthcare. So if they know a little bit about it, you know, you've got a leg up on it. And then we wanted to make sure that we reach out to people in the communities to say this disease exists and is fairly prevalent in New Mexico. And then if you're affected by CCM, we want you to reach out to your family and we want to provide free genetic testing. So we were able to get 4 legislators to sign on that first year and get about 75,000 from each one and get a little over $300,000 that first year. And then we went back the second year. What was really important about going back for funding is we wanted to make sure that in the interim, the legislators that did provide funding send thank you cards, reach out to them personally and tell them what the impact of what they did is to not just your family, but to the state of New Mexico, what you're finding. You want them to know that their money that they've allocated to you is well spent. And is being used in a way that affects as many people as possible. They're there to benefit the entire state. So we went back with some more information, and by that time we had published the book Bizcochito. So I went with the book in hand, and I gave out the book to the legislators that had signed on, and to other legislators that were interested, because even though they didn't sign on that first year, they might sign on the second year. And that second year, they provided funding for 2 more years. So we have 3 years of funding. And it sometimes dwindles, but that's enough. If you can get a good chunk the first year, sometimes you can buy enough supplies and you know, put it aside for future testing and such. But the real important thing is you know, I had the advantage of my husband being a legislator and how to navigate the politics. CCM is not a partisan disease. You know, it doesn't care if it's you're blue or red or white or whatever. Work with all your legislators. Know who your legislators are. Reach out to them, not during the legislative session, reach out to them way in advance. We did our presentation probably in August, between August and October, and the session wasn't even until January. So you have to be many, many months ahead of the ball on this. Connect with them, go to the legislature in person, make your face recognizable. And even if they can't support you this year, know that they possibly will support you next year. Network with people, network with other people, bring other people to help you support your request, bring other patients with you. They want to know that this isn't just an incredibly rare disease that is only going to help, you know, 2 people in the state. Come with your numbers and and sometimes if you don't have the big numbers, you do have the big impact. Know what this is costing your state. Be able to be prepared to tell them that if they could do better diagnostics, if they could do better testing and hopefully better prevention in the future and treatment, they can reduce a lot of costs on the back end. For Medicaid or whatever, you know, states are usually Medicaid. But it's not just the state legislators you want to work with. You also want to work with your federal legislators, because there are some acts that are being passed on a federal level. And you know, the best thing though is network, reach out to them, send them informational, make it personal on your stories. And always wrap around with them and say thank you and let them know how their funds have been used. And for example, these requests from New Mexico, they didn't start with me. They started many years in advance. So it's something that you have to know that may not work the first year. Be ready to go back year after year after year, and eventually you will be successful. So that's it on my part.
Thank you so much. It's just such an inspiring story, and you're right. I mean, it is unique to New Mexico and your situation, but there's lots of lessons that we can generalize from that. I was struck by the number that you said, 30,000, you know, and it made me realize just earlier, I had heard, I'm trying to put a number on CCM patients in the US, you know, and I think it's around 140,000. Don't quote me on it, but you know, it's a rare disease because it's under 200,000, but it's a large rare disease, right? So there's that, but then, like you said, just the impact that you can make on people's lives is really important to show. So thank you. I want to make sure we have some time. We have about 5 minutes left. There are a few questions here. One question, and I think this is to well, to anyone who wants to take, but Chris, I think you would be in a good position to talk about this. This question is, what is your best advice for people trying to get disability?
Get a lawyer. They don't, I went and got a cough drop, everyone. So good news. Get a lawyer. I actually am applying for disability. I was just declined for the second time. So now I'm going to a trial. Or not a trial, whatever, a hearing.
A hearing.
And that's great. Lawyers don't charge you. Most of the disability lawyers that I know of will not charge you up front. They'll take their pay out of the back pay from the government. And you got to be patient. I started this in 2022 and my case is still moving forward. They just now did my second decline. So it takes a lot of time. You don't realize the system is set up to not really support disabled folks until you need the system, is what I've discovered. So just be patient and get a lawyer.
Yeah, we're going through that with my husband also now. I mean, his disabilities are pretty extreme, but I would also say make sure that you have all your medical records in order. You'll have to list all the doctors that you've been to, so physical therapists, speech therapists, occupational therapists, radiologists, everything. You want everything listed, so track all that information, be ready to provide it. And like you said, Chris, be patient.
Thank you. I have another question here. And I'm just going to read it as I see it because I think it's interesting how it kind of, yeah, I'll read it. Okay. So I think it's really hard to explain. For example, when I have to try to explain my cognitive difficulties to my OT, at the last call, I was going to explain about my memory problems, that I have difficulty understanding following a conversation. The answer was that my OT does not experience any acute problems. I think as in the OT doesn't see acute problems and everyone forgets things. Soon, I don't know how to explain anymore, so they understand how my difficulties affect me. Do you have any tips? When you're trying to get through, it sounds like, and you're not able to explain what is the disability or what is the thing that's in your way.
I have that problem. I'd be happy to address that a little bit. From my experience, I actually go to neurocognitive testing every year. And then I started, and this is not to toot my belt, but I started with a pretty high IQ, and now I'm just like in the average level. And because I'm average, doctors will say, "Oh, but you're average, so you're fine." They don't understand that I've declined quite a bit. So another thing, I have a hard time following conversations too. But when you're seeing your doctor, make sure you write things down before that you want to talk about when they strike you. So I use my notes in my phone quite a bit, and I actually have notes for each doctor. And as I think about them, I'll just say, this is what I want to talk about. And although you may not see, always follow up with, you may not see it as an issue with me, but I know me, and this is an issue. And that would be how I would handle it in my personal situation.
Yeah, and I went through that with my husband also, that they're like, well, he seems fine. I'm like, this is not my husband. And he went through the cognitive testing, and even in the short period, the reduction in cognitive abilities over that short while were dramatic. So yeah, that's important to have that documentation.
think we have time for one more question that sort of piggybacks on this. Knowing that doctors are busy, knowing that medical providers are busy, this question is, you know, it is nice to print out and send documents to your medical providers, but as you know, doctors are busy. They don't have time to invest what is needed for each patient. How do we do this? You kind of talked about this, Sara, a little bit, just in terms of having all of your ducks in a row, but at a certain point, are you entitled to follow-up visits? Are you, you know, how do you navigate that, I guess?
Yeah, I mean, again, be prepared and prioritize. So what's the number one thing you want to leave a visit? Knowing, getting information about, having a test for, so, you know, really targeting what you need most. And then just sort of, I mean, sometimes we have to be squeaky wheels, like not settling for no. And it might mean waiting for a follow-up visit. You know, that's kind of just the way the system is, but just really continue advocating for yourself.
Awesome. There's some great things in the chat too. Darla had mentioned the Patient Advocate Foundation. If you guys Google that, which some of you already have probably, has a lot of information on disability. Yes.
I'm sorry. I saw in the chat and I forgot, and now I just remembered. So thank you. That people were laughing because their doctors are Googling CCM during the appointment. And what I would say, have our disease, we have maybe 200 people worldwide at this point for HOD, and we have the same problem, doctors Googling. And what I would say to you is that hooray that doctor wants to learn instead of just be like, I'm not going to deal with you. I'm going to brush you off. So maybe don't take offense to a doctor Googling it and trying to learn about it. That is actually a really good thing.
Thank you. That's a great point. We are at time and I want to respect your time, but I just want to thank you guys so much. And for everyone who tuned in, thank you for taking the time to listen and to ask questions. Darla is going to have a patient support group right after this. So you know, you can probably ask questions there too, if you want to kind of keep the conversation going. And yeah, our panelists, Chris, Sara, Christina, thank you so much for taking the time and sharing with us. And this webinar will be recorded and put up on our website, so you'll always be able to come back and look at the slides and listen to what folks have said.
Thank you, Dinah.
Thank
Okay.
you.
Thank
Thank
you.
you, Liz.
Bye.